Today we're going to do wrist stretches. Again, only do what's prescribed by your therapist. And with these stretches, we want them pain-free. So don't push into excess motion if it's hurting you too much. You know, if you can only get up just a little bit, that is absolutely fine. Alright, so the first stretch we're going to do is you're going to take your hand, nice and easy, put it on top of the other hand, and slowly come up. Hold 15 to 30 seconds. Arm can be right by your side, nice and easy. Hold it, and then come on down. You can take your hand again, keep the same position, and nice stretch downwards. Again, 15 to 30 seconds, hold, and then come on up. We can stretch to the side, and we can stretch this way. Nice and easy. I like to do, kind of get right on top here of your wrist, firm hold, 15 to 30 seconds, and then other way, 15 to 30 seconds. You can also grab your hand, it's like your hand shaking somebody, come on up, grab it, and hold it, 15 to 30 seconds, come on down nice and slow. Again, hand on top. This time you're kind of twisting it downwards, but hold it 15 to 30 seconds. Good stretch, all right?
Welcome to our video series about wrist strengthening. We have a couple different options here. You can have a hand weight, readily available at any store. Or at the clinic we provide therapy bands. I'll go ahead and start with the bands. First, we're going to do wrist extension. To start off with exercises, when you're first hurt, you want to make sure your wrist is off, your elbow is bent. Exercises are easier with your elbow bent. And all you do is you just kind of wrap up, grab that band. You could step on it to give you more tension. Wrap it up a little more here. The more you step on it, the more tension you get. You can control that. And all you do for wrist extension, keep everything else stable. And all you're doing is just lifting up your wrist. Wrist flexion. Just come around under like this. Lift the wrist up. This is wrist flexion. They also call radial deviation. Put your thumb up. This is another good wrist strengthening exercise to do. Again, everything stays on the bed, table. Up. Good. You could also do what we call supination, and that is put your thumb up, and you see that? See how my thumb is coming out? Against the resistance, I'm pulling that band out. Like that. Good. For ulnar deviation, you hold the band and you move your wrist out like that. This is a complement to the radial deviation we just did. For wrist pronation, it's a little awkward. You have to cross your arms like this. Grab your band, twist it. This is pronation. Biceps and triceps with a band, pretty similar to as you would do at the gym. You could also stand up instead of sit down for these. Biceps. Just move your elbow. And triceps you can hold here. Just straighten that elbow against resistance. That's working your triceps. If you move your hand a little bit, you rotate it, you're working a little different part of the triceps, so you can adjust where your hand's facing in or out. And there you go, you work a different part of the triceps muscle. This next part will be a complement of how you do those with the hand weight. Same position, looks very similar. Wrist extension. Only the wrist moves. Wrist flexion. Radial deviation. Supination. And then complementary coming back will be pronation. So you're working both supination here and then pronation coming back. Biceps. And for triceps, you'll actually take your hand, come on up, behind your head here, get a lot of resistance. Just come straight up. Straighten that elbow against resistance. Once you've mastered the exercises with your elbow bent, now it's time to do them with your elbow extended. People with lateral epicondylitis, tennis elbow, once they're better, can progress their exercises to do them with their elbow straight. This is very difficult to do for someone who has tennis elbow. But your elbow is straight, and then you start doing wrist extension here. You can also come out and do wrist flexion. You can rest on the table if you want. But the general premise is now you're doing these exercises with the elbow straight, the tendon's stretched out further, and it's got to work over the bone, so it's much more difficult. So only do these if your therapist has prescribed. Supination. Wrap it around, twist, elbow straight.